Dr. Choi, incoming.
Where we going, Maggie?
Trauma 2.
Bret Cooper, 17-year-old male, down on the ice after a hip check. GCS 10 improved to a 12.
Rotate.
Must have got his bell rung.
I'm his father. I was there. He didn't get his bell rung. He barely got hit.
Bret, I'm Dr. Choi. Can you hear me? Can you breathe?
Get me over here!
All right, let's transfer him. Reese, on your count.
Okay, nice and easy. 1, 2, 3.
Transfer the oxygen, leave him on the cannula. Let's get him up on monitors.
On it.
Check his stat levels. Okay, pupil is equal bilaterally and reactive.
He stayed on his skates the whole time.
Bret, I need you to focus on me. Is there any pain?
Ah, there, right where you're touching.
Titrate dopamine.
You're still Reese.
He needs CT head and spine, and I would get him a chest x-ray.
Come on, really?
We got this.
Oh my God. Is it a concussion? What happened, Jack?
He was battling for a puck along the boards. It's nothing.
We are in the emergency room, Jack.
Mr. and Mrs. Cooper, I'm gonna need you to step outside.
Bret had a bad concussion last month.
Honey, it's not a concussion. Look, Doc, he's got a scholarship on the table from Boston College. Another concussion, they might rescind the offer.
My eyes, everything's blurry!
Bret, you have to stay still. Please, Bret, you have to hold still. Hold still, buddy.
Dad!
Son, you okay?
Dad!
Bret.
Dad, I can't see! I
still, Bret.
can't see!
Stay still, Bret. Stay still.
Doc, hey, how is he?
What happened to his eyesight?
His vision's fine. It was a transient impairment probably caused by anxiety.
What about his head? Is it another concussion?
Can't say for sure yet. We're doing a CT of his head and cervical spine to make sure there's no bleeding. That might require surgery.
Surgery? Oh, God.
I'm not saying he needs surgery. We just need to rule everything out.
Relax, son, okay? Let's not get worked up before the tests come back. It's like I said before. It looks worse than it is. Look, Doc, I played 18 seasons. I took a hit or two. 99% of the time, it was nothing. I sat out a shift, got right back in.
Trust me, I get it. Listen, as soon as we get the test back, we'll figure out our next step.
Okay.
Thanks.
Sure. Man.
It's gonna be fine.
So then I just break up the center and carry the puck into the zone myself?
Exactly. You catch the D-man in the neutral zone.
And I'll be left to the 2-on-1.
Good read.
Okay, put that away now.
Good news. CT head and spine were clear.
No concussion.
No concussion.
So I'm out of here.
And off to Chestnut Hill. Go Eagles.
Sweet. Thanks, Doc.
Sure.
Sports aren't really my thing.
What I tell you, hon? Nothing. The kid's a rock, like father, like son. Doc, thanks so much.
You got it.
Okay, so let's go tell those bad news scouts that the nation's #1 recruit is good to go.
Dr. Choi, it's possible you missed something. Bret complains of headaches.
Oh.
He's had this one for 2 weeks.
Joan, enough. Look, the scan came back clean. Honey, stop looking for something that isn't there.
LP?
Headaches could be a symptom of meningitis. An infection like that wouldn't show up on the CT. Could explain why a minor hit caused such a big reaction earlier. I think it's best we do a spinal tap.
Okay, but look, meningitis, that is treatable, right?
Hockey can wait for an hour, Jack.
Okay, Joan. Come on.
So, Bret, if you could lie on your side, pull your knees up to your chest. I'm gonna numb you with a local anesthetic. Are you okay?
Feeling a little dizzy.
Okay.
Bret?
Bret?
Bret!
Reese! Little help!
A brain infection, like meningitis?
You can treat this with antibiotics, can't you?
Possibly. We did catch this one early. This is cerebritis, not meningitis, which is not only serious, but stems from some underlying condition, one we have yet to find.
So, more tests?
Afraid so.
Hey, third period, son. We got this.
Often, brain infections are caused by inflammation in the sinuses and in the ears. Your ears look okay.
Always know you want to be a doctor?
Yes. I don't know. As a kid, I was intrigued by anatomy, dissecting frogs and looking at their organs under the microscope. But here I am in the ED. I never thought I'd be dealing with people in their most difficult times. And you? Hockey. Hockey is so...
Vicious?
well, yeah.
Yeah.
I don't understand how someone could risk all of their teeth for a game.
My dad played pro, and I was skating before I could walk. You know, if I wanted a different career, nothing else would feel right on me. Guess you can't escape who you are.
You've got a little dried blood in your nose, but it's probably just because of the fall.
No, I had a nosebleed this morning. I get them all the time.
All the time?
Yeah, it's no big deal.
Can I take a look in your mouth, please?
Okay.
I'll be right back.
Bret has a condition called hereditary hemorrhagic telangiectasia, or HHT.
HHT, what's that?
Hey, it's okay, son.
It causes the blood vessels in different parts of the body to form fragile bundles called arteriovenous malformations. These AVMs can sometimes allow bacteria to seep into the blood and spinal fluid and cause an infection.
Is it curable?
It's manageable. The AVMs can be repaired, but they have a tendency to recur.
Okay, so what does it mean?
I can still play, right?
We'll try to monitor any AVMs that might develop, but if there's an AVM we don't know about, one wrong hit and you could suffer a catastrophic bleed. Look, I'm sorry, Bret, but it's my recommendation that you quit hockey.
Okay, listen, if he's had this his whole life, why is it only a problem now? You know what? I am getting a second opinion.
Hey. It's gonna be okay, sweetie.
Mind if we have a minute?
I'll be right outside.
You said if I take the wrong hit. Are you saying I could die?
That's what I'm saying. Listen to me. I know what you're thinking. 1 in a million hit can't happen to me. But it can. It can. I know. Think about it.
You'll find another path. And it'll feel right. I'm sure of it.
You see what Bret tweeted?
Off my skates for a couple of days, but I'll be back at All-Star Clinic stronger than ever. Hashtag down but not out. Seriously? He's still gonna play? I told him he could die.
Boys will always want to be better than their fathers, which is precisely what their fathers want. What price glory, right?